Thank you so much for joining us today. We appreciate you taking the time to be here through everything that's happening and being flexible with us having to change. First of all, your screen right now, these are some of our great sponsors that have helped to make this summit happen. So as we go through today, we do invite you to kind of share in the chat function things that you're doing in your local areas regarding suicide prevention. We would love to hear from you. Just to give you kind of an idea of what the format of today is going to look like. So obviously this is a panel. So what we're going to do is we'll start out by having each of our three speakers go ahead and present briefly for probably about 7 minutes and ask our panelists that I have, and then once we're done with that portion, then we'll open it up to you. So what I'm going to ask you to do to kind of, if you do have questions, go ahead and put those in the chat, and then as the moderator, I will, be monitoring that for your questions and making sure that those get answered. All right, so just to kind of quickly introduce, there's 3 speakers today. Again, my name is Amy Mickelson. I'm with the Utah Department of Health. So like I said, I will be moderating today. We will have 3 speakers. I'm going to ask each of our speakers when they do their presentation to just do a brief introduction of themselves. So we will have Jesse Spencer, who's with Intermountain Healthcare. And then we will hear from Teresa Willie from Southwest Behavioral Health. And then we'll hear from Robin Hatch from Northern Utah. We'll go ahead and turn the time over to Jesse.
Great. Hello, everybody. Can you hear me and see me okay? Yes, I got a thumbs up. Amy, you were a little glitchy. I think it's probably the internet here in Richfield. Everybody must be watching Netflix or something at the same time. It doesn't take much, as we've learned, with these COVID times, to overload the internet here in town. But so, give me a thumbs down if it's breaking up, and we can try something else. But so, thank you again for the opportunity to be here. This is great. I appreciate the opportunity to spend a few minutes with you all today. I have always, anytime that a bunch of people can get together and talk about rural health, I think is great, and the collaboration that I've seen in some of the other meetings today has been great. I think this is fun to do it virtually, and we're learning to do all sorts of things virtually, so this is a lot of fun. My name is Jesse Spencer. I'm a family medicine physician in Richfield, Utah. I'm a Utah product. I grew up in Salt Lake and saw the light and decided to move down to Richfield after finishing my family medicine residency at McCady Hospital. Part of the reason I wanted to come to rural was for scope of practice. So I practice full family medicine, which is kind of the old traditional way, I guess. I see my own patients in the hospital. I do clinic, deliver babies, work at the skilled nursing facility, work at the school, do the high school sports, all that kind of stuff. And that's part of what drew me here. Is I probably have a little attention deficit. It's been nice to have my hands in all the things rural, like many of you. The other reason is just because it's beautiful. I mean, I don't know why you would live anywhere else. I look out my window and it's wide open spaces and blue skies and red rock on one side and beautiful alpine mountains on the other side. So I've been down here for about 9 years. Really appreciated it. Have loved it. Have loved raising my small family here. And so I'm employed with Intermountain Healthcare, and we've, of course, suicide has been something that's been talked about a lot over the past couple of years, and it's got a lot of attention. And I hope that attention continues on this particular topic. It hits home, small town Richfield. I'll never forget. I was actually in Salt Lake at a meeting. It was a little over a year ago when a friend of mine called just in an absolute panic, and because his son had just passed away from suicide. And I'll never forget that phone call, right? And I felt terrible about not being there for him at the time, and it's haunted me. But that year, that particular death kind of was, I think, the 6th or 7th teenager that we had seen in about a year here in the Valley. So that obviously that touches everybody in town, right? I mean, it doesn't take much in a small town for everyone to feel the pain, and we were hurting. And being employed with Intermountain Healthcare, we asked for some resources, and one of the things that Intermountain pushed last year quite heavily was this CALM training. And I'll talk a little bit about what CALM training is, and then talk about our experience here. I just realized I don't have, I'm not flipping through the slides, right? Is somebody flipping those for me? Amy? I could pull it up on my screen.
Froze for just a second. Yeah, it froze for just a second. Let me try to get this up. And
do you want me to? Okay, I mean, I can share my screen if you'd like, and then I've got it on my screen either way.
Let's see if we can get this working. Oh, there we go. Okay.
Oh,
which slide are you wanting right now, Jesse?
Yeah, this one's fine. So this just shows, the issue that we have in Utah. I like this graph. It shows, Utah males versus U.S. males were above that. Utah females versus U.S. females were above that. I don't think it's any surprise to this group that it's a problem. Go ahead and move on there. And one of the questions that I think is a fascinating question, right, is what if the most important factor driving our disproportionately high rate of suicide isn't mental illness? So what if you took, I mean, it's one thing to say, we don't know why exactly. It's a complicated issue, but maybe it's not really disproportionately high, or there's other reasons, right? And I think that's what led us down this road of talking about lethal means. Go ahead and put the next slide. There was an interesting study done that showed that, high gun states versus low gun states, they normalized them as best they could with numbers. Household gun ownership was 47% versus 15%. And you can see the total suicides there. High gun states have, almost double what low gun states have. Again, you got to take data is occasionally helpful and never perfect, but occasionally helpful. So you take it with a grain of salt, but I think it's fascinating data to me. And of course, living in a rural town and living in Utah, guns are a part of our culture. Even growing up in Salt Lake, we hunted, and then living in rural Utah, I mean, it's much more kind of ingrained into the culture, which is not a bad thing. It's an association, right, that we have to pay attention to. Next slide, please. One thing I think, when you talk about suicides in Utah, it's interesting to know that 51% of all suicides are by firearm, and 85% of all firearm deaths are suicides. Again, I don't know that this is terribly shocking to anybody. Go ahead with the next one. This one I thought this data was a little more interesting. A study done out of Utah. What proportion of rural youth gun suicide involve a long gun? So typically when we think about suicide and we're thinking about guns, we're thinking about pistols and things like that. But this shows that actually long guns are used very frequently with rural with our youth, right? And that's probably what we have more in rural towns and more accessible. I think there's a little bit of a misconception then that they're safer, right? They're the hunting rifles and things like that. But interesting data there that shows that those are actually being used. And that's been our experience actually locally here. Next slide, please. And then these are not projecting really well, but this just goes to show, again, culturally, this is an important part of our culture, of our rural culture. Guns are an important part of this. These kinds of raffles, we see these all the time. Our 4th of July parties, right? Like there's usually 2 or 3 small businesses that are in the parade that are, come and see us. We're having a raffle or a drawing for a gun. So this is part of our culture. And again, I'm not saying that's a bad thing, it's an association that we need to consider. Next one. Next slide, please.
All right, froze again.
Oh, well, I'll just go ahead and tell you what that is. So why is it important to talk about guns and to talk about lethal means when we're talking about suicide? Well, number one, many suicide attempts occur with little planning during a short-term crisis. There was a study done that showed about 50% of suicide providers started thinking about suicide for 10 minutes before they acted on it. So 10 minutes, right? You've got this window where a thought occurs, a bad thought occurs, a dark thought occurs, and then they acted on it in 10 minutes. And why is that important? Well, because guns are deadly, fast, and irreversible. More than 80% of the time, if somebody uses a gun, it's fatal. And, you compare that to some of the other methods that are used, like sharps or poisonings, overdoses, and that's less than, those are fatal less than 2% of the time. So they're much more fatal, much more irreversible. And then, it's not true that patients who are community members, family members, friends who resort to suicide attempts, it's not true that they're just going to find another way. Most survivors actually of suicide attempts don't go on to find another way. And again, a life saved is a life saved, right? And it's worth it. So the CALM training is, go ahead and, the next slide. CALM training was a collaboration from state officials, healthcare professionals, gun owners, survivors of suicide, veterans, law enforcement, all sorts of people got together and came up with this training. And it's basically, the common goal and the common theme is that no person in suicidal crisis should have ready access to a firearm. And then, we talk about other lethal means, but mostly it's focused on firearms. And the main messages are, you've got to respect gun rights. You have to focus on safety. You respect the sacrifice it is for people to remove themselves from their lethal means when they're having a hard time. The basis of it is, it's friends helping friends stay safe. It's not prohibitive. We're not taking taking guns away. It's prevention. Go to that next slide, please. I think that's the last slide I have. It's really a collaborative conversation with the gun owner and using the right words. So language, the words you use matter. We're not taking your guns away. What we're doing is removing these for the time being, hopefully off-site, away from your home. But if not, what can we do inside the home to make it a safer environment? And so the CALM training was set up. It's available to all healthcare providers through the state. It's something that you can take online, but what we've done in our community is that I took it, I think a couple of our other docs took it, and then we have set up small meetings where we've met with the medical staff and some education folks. I meant to give you a bunch of feedback that we were going to have on this meeting in March. That was one of our bigger planned meetings, but unfortunately canceled everything. So that March meeting didn't happen, but that was with healthcare professionals, some education professionals, and as well as some spouses and community members. And so, we've got 2 or 3 people in our community that are trained and interested in it, that teach it essentially to some of the other healthcare providers. So, the act of getting on the internet and clicking and taking an education isn't palatable to a lot of healthcare providers. But if there is somebody that takes up the cause and will do the training, and you can make this presentation, long, short, kind of whatever, you can tailor it to your needs and really get out there and hopefully make a difference. And that's kind of what we've done here. We've got plans to do a lot more of it. We've got plans to maybe do some small little research studies within our community about perception of this type of education and how that plays into it. So we're looking forward to continuing this. And it's something that I think, when I think about meaningful things that I do in my community, this rises to the top, right? I mean, it's suicide in rural towns, suicide anywhere is a tragedy. And I think it's preventable. And I believe that we can do things as healthcare providers and healthcare professionals to mediate the damages and from suicide. And I think what I've seen in a rural town, and again, this is just me editorializing, a lot of times it seems like these tragedies happen and the burden has fallen a lot on the school systems, particularly, with our teen suicides that happen. And I think that there's obviously a spot for school systems, but we in the medical field need to rise up and do something about this as well. And this is something that I think is a valuable tool in these communities. I mean, certainly we need other things like mental health resources, and we need trainings on, all sorts of things, how to cope, mindfulness, kindness, whatever. But I think when push comes to shove, if we can talk to our friends, our family, our patients about access to lethal means and do it in a respectful way, I think this can actually do a lot of good, right? And do good and prevent some of these heartbreaks. And I'll turn the time over, and happy to take questions about the program or whatever else at the end, it sounds like.
All right. Thank you, Jesse. We appreciate it. Great information. So I'm going to we'll go ahead and turn the time over to Teresa Willie now. Hi, Teresa, you're still muted.
I started talking and I was still muted. Oh, okay. Well, I'm excited to be here. Thank you for inviting me. And I was asked to talk on what we are doing. What are some community-based strategies and approaches to address firearm safety? And so as we are a CTC and SPIF model coalition, we are following the 7 strategies of change in an effort to make an impact on our community for suicide prevention. And so we followed those 7 strategies by doing education, building skills, providing support, enhancing and access and reducing barriers, providing incentives, and also changing policy. So next slide, and I'll tell you how specifically we're doing that. So to provide information, we have used the Is Your Safety On campaign to help educate firearms owners about being safe, keeping their firearms safe in their home and however else they're using that. We've put posters in our gun ranges, and we've also played the Is Your Safety ads in the theaters and on the radios. And we've given the gun ranges pamphlets as well. And then we've gone to gun shows and given out some swag, and more importantly, had some really critical conversations with gun owners about locking up their firearms and the reasons why. And building skills, we do a lot of QPR training in our community. QPR stands for Question, Persuade, and Refer, and it's a gatekeeper training so that people can learn how to ask the question, persuade a friend to get help, and then refer them to critical resources. We also have used the calm slides in our suicide prevention trainings and the Means Matter slides. So all of our QPR trainings have those firearms slides in them so that people are getting that firearms training as well. Enhancing barriers, we give gun locks at every single one of our QPR trainings or any kind of suicide training that we have in the community. And then providing incentives, we've promoted the gun safe rebates. So for those of you who are not aware of that, the Division of Substance Abuse and Mental Health and the Bureau of Criminal Identification have gotten together to give rebates on safes up to $100. And I believe this expires at the end of June or until all of those funds have been exhausted. But if people want information on that, they can go to saferebate@utah.gov, and we promoted that in our community so that people will be incentivized to purchase those safes and use them in their home. And then we have advocated for policy change I'm going to talk about him in a minute, but one of our prevention specialists is also a QPR instructor, but more importantly, he's a gun range owner. And so he has approached the Utah Department of Public Safety to try to mandate that they put these firearm slides into their concealed carry permit training. So that would be mandated. Rowdy's been doing that ever since we approached him, and hopefully that's something that can happen soon. And then providing support. So I think an interesting story, and Amy, you can go to the next slide. I just wanted to share a story. So in December of 2018, I got a phone call from a news reporter in New York with NBC News. His name was John Shupe, and he called to see if I'd be willing to do a story over the phone, an interview over the phone. And I didn't know who it was, and I was kind of in a rush. I'm kind of glad I didn't know who that was, because he was kind of a high profile reporter. But he asked me if we could talk about how we're working in rural Utah with the firearms community and the prevention advocates for suicide. And when we had this discussion, he seemed a little surprised that we weren't at odds with each other, because I guess across the country there are a lot of conflicts between the suicide prevention community and the firearms community. But we had a really good discussion about that, and I was able to tell him that one of the most important things that we did is just walk into gun shops and to ranges and start having conversations with those owners. And as a result of that, Rowdy, the range owner at this particular gun shop, not only was he very, very eager to put the posters up and to incorporate the slides into his concealed carry courses, but he eventually became a QPR instructor, and he loved that so much that he's currently working as a prevention specialist in our office. And I share this story not to brag about the attention that we got nationally with that, but the reason I share that is because sometimes we're afraid to go in and have those conversations because we think that people are going to resist the information that we have. But the more likely that we are to approach some of these more unique partners in our community and just start up a conversation, let them know that we are willing to work with them and that we're not working against them in any way. That way that we can build those relationships, and they can become not only helping in that way, but they can become really strong advocates, and they can advocate in a way that the rest of us maybe can't. So those are some of the things that we're doing in our community. We're really excited about the way that we've partnered with the firearms community.
All right, thank you, Teresa. That was awesome. And we will go ahead and turn over the final few minutes to Robin.
Thank you, thank you. I'm Robin Hatch with Northeastern Counseling Center. I have been at Northeastern for 22.5 years. I'm the prevention coordinator for our district, and I cover Uinta, Daggett, and Duchesne counties. Okay, next slide. Okay. One of the things that I think is really important when we're doing our prevention work is that we know what is going on in our community. Jesse mentioned getting local data. I think that's really important to get your local data before we start going out and work, because to fix a problem, we need to know what's going on in our communities. So one of the things that we found in our community is that most of our suicides were the adult males that were in the workforce and our farmers. And we also know that these are the least likely people that would access our prevention services. They're not going to our health fairs. They're out working. They're just not participating in a lot of the prevention work that is going on in the community. We did note that access to lethal means in our area, 80 to 85% of our suicide deaths are firearm, and over 60% of those are with the long gun, like Jesse's slide showed. We also had to acknowledge that access to resources is an issue in our area. We have offices in Duchesne, Roosevelt, and Vernal, and we actually send therapists all the way up to Manila. But even though we're covering that broad range of a territory, we still have people that have an hour or more just to access any assistance if they are in crisis. We also had our Uinta Basin Association of Governments community assessment showed that 50% of our population did not know where or how to access services if they did need assistance. So these were some things that our coalition just took head on. We've got to address these things to make a difference in our community. Next slide. So one of the things we did is we did go into a gun show. What was really interesting about this was the National Public Radio heard about this and sent a reporter out to shadow us for an entire day. I really thought, like Teresa was mentioned, that they thought we'd have a lot of conflict in this. But before we did this, we actually made some friends with our Northeastern Utah Pistol Association. And we put people behind the booth here. So 3 out of the 4 people behind this booth are actually concealed permit holders. So we are not anti-firearm ourselves. And we were giving away gun socks. This is an item that slips over the gun to protect it, keep it away moisture and keep away dust. And we printed the suicide prevention number on this. Go ahead, next slide. Okay. So on this, we were addressing the access to firearms. We distributed about 1,000 of these gun locks or gun socks, getting that number into different homes. We gave away 1 per person, and we gave away about 3,000 gun locks that day. And we encouraged gun owners to let them know that it's okay if they take their friends' firearms. If their friend's not doing well, that is absolutely okay for them to just say, you know, we're worried about you, we're gonna take your firearms and store them at our house. Just like you would if your friend was drinking alcohol and you were concerned about them, you'd take away their car keys. There's just sometimes people shouldn't have access to their firearm. Oh, next slide. Okay. And know your community. The farming community was something we wanted to address. Not only do they have a lot of firearms and access to firearms, they're a different community also. They are not getting the companionship and the interaction with coworkers like other populations do. This gentleman here is actually the vice chair of the Utah Cattlemen's Association, and he'll be playing an important part in our prevention efforts as I get down here a little bit. Go ahead, next slide. Okay. So to address the farmers, one of the things we found is that the Farmer's Almanac will actually sell you the bottom third of their little magazine and the entire back cover. So we distributed these into places where farmers would go, into the tire shops, into the grains, the Intermountain farmers, those types of business. And they actually were helping us distribute these. One store even took the ones off the shelf that they were selling and gave ours away for free. Next slide. Okay. So to make this more personal, we actually developed our own commercials, and we partnered with Dan Crozier, who is the vice chair of the Utah Cattlemen's Association. We had 4 radio commercials made up, and to date we have video for 2 of them, and this is just one of the videos, if you can play that.
There's a closeness despite the acres that separate us. We're quick to lend a hand, an ear, or equipment to get the job done. That same community supports your mental health too. Make sure that your well-being is a priority and talk to somebody if you or someone you know needs help. Call the Lifeline at 1-800-273-TALK.
This message brought to you by Northeastern Counseling Center and Tri-County Health Department.
So we partnered with a few people doing this commercial. It's been a lot of success. And I forgot to mention that with that NPR came out, that story went through the state of Utah, and about 2 months later, it actually went national. Oh, next slide. Okay. So one of the things that I'm really strong is we need to take advantage of the opportunities when they do present themselves. Christina Flores with Channel 2 News actually came out, heard about some of our efforts here and that we were addressing farmers. and actually spent a couple days down here and did a story. And KUTV did air about a 5-minute segment on their 30-minute news broadcast. So we're really appreciative to the extra efforts, because it does make our community notice these efforts, and it makes it easier to get partners when you're pushing these efforts. Okay. So next slide. So some of the things that we want to know is we can't have just these standalone efforts. We've got to keep the momentum going and doing these. So some of our next projects is we're going to hopefully get some hunters vests and get the suicide prevention number on those, and work into the hunter safety courses where the kids have to go in for the first time, get those classes done before they can start hunting. We're also going to, our plan is to get some ammo boxes and encourage people to always store the ammunition in a locked box away from their firearms. And we will be printing the suicide prevention number on those boxes. Next slide. Okay. So one of the things we do is we do want local businesses to partner with us and assist in getting our messages out. A lot of times your local businesses will prevent, oh, next slide. Okay, there you go. We'll be printing calendars and stuff at the end of the year. Can they put the suicide prevention number on the bottom of those for us? Help us get those information and the numbers that are needed out into our communities. Okay. We're asking them to incorporate prevention into their company activities. Can they do family events? We know that bonding with family is a huge protective factor. Can they incorporate those types of activities in theirs? And can they flex their time for their employees to participate in prevention services? So we also have a lot of mental health first aid classes, but it's an 8-hour class. Can these businesses put that employee on a 410s for 1 week so that they can participate in this? Can they give them the day off? We have some companies that will actually pay their employee if they participate in our mental health first aid. Next. Okay. But really, it's nobody's job to take care of suicide problems in our area. It's a joint effort for all of us. And it's going to take all of us to make a difference in this. So next slide. So I just want to thank you for your time. The medical professionals are definitely partners that we need in this fight against suicide. Thank you.
Okay, great. Thank you so much. That was awesome. I think I know a lot of what's going on with all 3 of these panelists, but I still learned some things, so I appreciate their time. So now I'm going to go ahead and ask the panelists some questions that I've prepared, and then we'll open it up for questions from all of you. So feel free as we're going through this time, if you want to put questions in the question and answer for the panelists, and then we'll make sure we address those after we've done some of my questions. Okay, so the first question I have is for you, Jesse. So when you're doing calm counseling, when you're doing this with like an individual or a family, and you have a family that's maybe resistant to kind of this information, how do you kind of overcome that with that family or that individual?
Yeah, so I mean, it does take practice to talk about these kinds of things, and the training actually goes over that a little bit about, how you can deal with certain situations and ideas, I guess. And personally, I don't push terribly hard, right? I mean, as clinicians and healthcare providers, we're pretty good readers of people. We get a pretty good sense of how our message is going across. And I think that just being, what I always fall back on is safety, right? So that conversation of, I'm your friend, I'm your neighbor, and I'm your doctor, and I want you to be safe. And this is a method that, let's talk about it. Let's talk about the barriers if there are some. I don't ever push super hard if people are very resistant. And by the way, that I think I'm only thinking of one patient that came up. Most of the time, I'm able to kind of get them over those barriers and come up with something. And it might be super temporary, right? So if it's not take the guns out of the home, it's change or let the spouse hold the keys or hide the keys, or take the ammunition that was mentioned already, take the ammunition and separate it from the gun, and maybe put those in two different locked places, or the ammunition stays, with a spouse hides it or takes it to a relative's home or something like that. So I think it's just about being, pushing those relationships that we've made with our patients already, and communicating as best as possible, being genuine. I think that always helps. Being genuine, being transparent. I don't think transparency ever is harmful, and it works pretty well.
Great, thank you. All right, so for Teresa and Robin, would you share with us like some lessons learned that you've learned, lessons learned in your work in working with the firearm community, and some things that, like I said, some things that you've learned from that?
Well, once again, I think you need to know who your audience is going to be before you get there. Again, we had partners that were already at the gun show with the Utah Pistol Association, the Northeastern Utah Pistol Club, and we had our booth right next to theirs. So I think that was help, but also be prepared for people not liking what you're doing right away. We had people irritated until they started talking to us. Immediately they were bringing up a wall. When we first did this, there was a lot of people pushing for some red flag laws, and that's probably not a good time to go into a gun show. But yeah, we were well received. Once they realized that we were not anti-firearm, that we are just safety concerned, they're right on board. They're really right on board. Gun owners know that firearms can be a dangerous tool that they have. They take precautions most of the time anyway. It's just when somebody's in a bad place where things need to be changed.
I think the most successful thing that we did in our county is try to find champions that already had leverage in that community. So going into the gun shops and saying, hey, you know what, you're a gun owner, you know your population, like Robin said, but they also have some leverage. So when we do our radio ads, Rowdy's one of our spokespersons, and he'll talk about that. I'm a firearms owner, and I own a gun shop, and people know Rowdy because the shop is named Rowdy's Range. And so because he's an expert in the field, and because he's speaking for safety, he champions that for us. And I think that's one of the most effective things that we've done, is find those champions.
Great, thank you. Okay, and I have one more question for all of you, and I'd like to kind of have Jesse go first on this one. What are some next steps that participants could take in their own communities?
So from my standpoint, I think it's finding a champion to take up the CALM training, and perhaps offer to train that to the other healthcare professionals or business leaders or gun owners. I mean, I think you just need a champion, right? And that's something that you hear in these conferences all the time. You need a champion, but there are, on a very kind of granular idea would be, the medical society meetings where you can get your providers together for medical society meetings, and you eat dinner together and you talk about something medical. That's a good place to bring up CALM training. The school districts, I think, are valuable places to bring these up, and they're kind of like super involved with this already. But I love the idea of reaching out to the gun owners, going to gun shows, reaching out to the farmers. That's been the tricky part, I think, in our community. And so I was thrilled to hear some of that is, finding, for me, it's going to be making connections. I think my next step is making connections with some of those people that don't come to meetings, right? Because they're out working on the farm, or those people that need to hear the message. But I think to get started, you need to find a healthcare professional champion, And I really like the idea. So I don't hunt a lot. I don't hunt anymore. And the message coming from me alone is probably not the right thing, right? So I found a partner who's a gun owner, and I think that's important too. So you find a team. I find a team of people if needed to take up the cause, take the training, and then offer to get these small groups trained.
I'll let Robin go ahead.
One of the things that I would suggest is to get a hold of your local prevention coordinator if you're looking for next steps. Our state is divided into 13 areas, and each one has a prevention coordinator, and they can put you in contact with people who are already collecting the data and starting this process. And you'll be a huge asset. If you've got the passion to make a difference, you will be a huge asset to their group. So just try and find out what's going on. Don't duplicate it, and get the data to find out what's going on in your community.
I guess the things that I would suggest, ditto to both of the things that you both said, but also the Utah Suicide Prevention Coalition is the umbrella coalition for the state, and they can network with hook you up with everyone else in the state to network, to find ideas. Data collection is shared, strategies that we know are evidence-based and have positive outcomes can be shared. One of the things that we've done, well, several times, is every couple of years we do a community readiness assessment. So if you don't know where you're at and which strategies to use, you can do that by doing that readiness assessment, and it will tell you where you need to be and which strategies to apply to move forward.
All right, thank you. Thank you. Very, very good insight, very good information. So just so I don't forget to mention this, I brought up the sponsor slide. I didn't mention that if you are looking for CME credit through the American Academy of Family Practitioners, the information at the bottom of this slide gives you that information on how to follow up and do that. So I wanted to just make sure that that was up while we kind of finish out the panel. But of course, also kind of remember, like as Teresa and Robin both said, there's partners in your local areas if you're looking for community-based ways to get involved. That Utah Suicide Prevention Coalition is a great place to kind of start kind of making links to those organizations, but you're always welcome to reach out to us as well. Before the end of this panel, I'll go ahead and put that final slide up again that has all of our contact information. So if you want to reach out to any of us, you're welcome to do that. We would love to be able to kind of get you linked up with people in your community that you can do some of this work with. All right, so let's go ahead and do some questions. Let's see. All right. Let's see. So let's say that the firearm safety removed from a depressed individual or a family who have a member with depression and suicide thoughts. How is the main consideration of suicide by the affected individual handled?
So yeah, I mean, I think that's a great question. So if you can take the weapon away, I think if I'm understanding this correctly, so we've decided that, you know, we've found somebody who is thinking about suicide, and we've worked it out where the lethal means are removed. The lethal means hopefully is gone, and then what are the next steps to take care of that patient who is dealing with suicide? Well, that's a good question. You know, that's a great question. I think, and that's one that we're all struggling with in the nation, in the state, and of course in our rural communities, right? So that's where you work collaboratively with your mental health people. We have a sparsity of mental health providers in the state, and of course in the rurals, it's a little bit more sparse. primary care providers, I believe, and of course I am one of these people. And so I'm a family medicine physician and I think that we need to do additional training. We need to know because we see a lot of this, right? I mean, in primary care, we see mood disorders all the time, and we're getting better about asking about suicide specific questions. But the next step is, help. We need to take additional training and get additional education about what we do for these particular patients. How to move forward with these with the help of other healthcare professionals, but what can we personally do as well? And I think that's something that we maybe didn't spend enough time on in medical school and in training, but I think we can go back there. And I think we're seeing that, in organized medicine, we're seeing more journal articles about that. We're seeing healthcare organizations reach out and offer olive branches or not olive branches, education. And, I think, in this time of COVID, I've been thinking a lot about how to leverage technology. I think we need to leverage technology, right? I mean, if we don't, I think there's a lot of opportunity for video visits or even some artificial intelligence, asynchronous kind of visits that we could do with patients who are dealing with suicidal ideation. Good question, though. That certainly it would be the next step. I sleep a lot better knowing that the lethal means has been removed, and we can, because that's the immediate what to do now, and then the rest of that I think takes some time.
Amy, one of the other things that we're doing in our county is we participate actively with our CIT training. So those are officers, they may be the ones that respond when there needs to be lethal means removed, and they're trained in how to respond to a mental health crisis. And then we're currently putting together some packets for our first responders so that when they do come on a scene, or if there's an attempt or if someone dies by suicide, they're able to give packets to families so that they have additional resources and they know what those next steps might be.
Thank you. All right, so Lisa likes the gun sock idea and wants to know where to get them.
Okay. Well, we actually worked with our local sporting goods store that's in the back of our Ace Hardware store. They were able to purchase the gun socks for us. They didn't charge us anything, and they even drove their forklift over with the whole pallet to me, so I didn't have to go get them. And then we found a local printer that printed on them, and his staff donated their time and they printed them just for the cost of the stuff. After the news stories went out and the gun sock company found out about that, the next set that we ordered, they actually had them printed for us at no extra charge. So again, take advantage when these things come up and you get a little attention, really take advantage of that and get those extra resources. It's a good time to promote what you're doing, is when you're getting a positive attention for it.
Thanks, Robin. And I want to share in the chat a comment that was made by Lisa, and I think this is a really important comment. I've had personal experience storing guns for someone in crisis, and they are 3 years past that critical time and doing well. We'll never know what might have happened, and I'm happy we knew what to do. And I think, thank you so much, Lisa, for sharing that, because that's really important to kind of understand that, we're reaching out, we're helping people in a crisis situation, and those few moments that you just reach out and offer that, that safety for them can mean the world to keeping tips on what to say. You know that person has a gun.
Another thing is, one of the biggest barriers to getting help is stigma. And if stories like this get out, I think it'll make it more normal for people to start doing this. Years ago, when they did the the designated driver and taking away car keys. I'm old enough to know that, remember, it's like, you can't just take somebody's car away from them. I mean, it's their car, but it's the same thing. People don't hesitate to take a car away anymore. It can be the same with firearms. We just need to work on the stigma, reduce the stigma, and let people know that, I mean, 3 years, recovery is possible.
Thank you, Robin. I think something that's really important too, like when we are talking to somebody, is like just letting people know that we care. I mean, I think that this all comes down to just being human with people and being kind. And I liked what Jesse had to say when he was talking about, working with somebody that might be a little bit resistant to some of the information that he's providing or what he's trying to do. I think it really just comes down to being human and letting people know that we care about them. And I think too, like if we're concerned about somebody, it's always good to, it's never a bad thing to reach out to people and say, hey, I'm concerned. I know that you have a gun, and I'm concerned about when you say that you are going to kill yourself, and having that conversation and asking that question if they are thinking about killing themselves, talking to them about what are some things that we need to do to keep you safe and get you to some resources for help. And I think that goes back to what Robin said, is like, how do we get rid of stigma? And the more that we talk about this, the more that we get people trained in our communities, the more that we kind of normalize talking about mental health, the more that we can kind of reduce that stigma and break down some of those barriers for people getting help, and particularly in some of our rural areas where people are less likely to reach out and get help. And how do we kind of keep having those meaningful conversations and kind of shifting some of that mindset and that stigma around suicide. All right, so next question. What can communities do to help support these groups?
Well, I'll also just say is get in touch with your local coalitions. Most areas do have prevention coalitions that are going, and most areas are addressing both the substance use prevention and the suicide prevention. So if you go to the Division of Substance Abuse Mental Health website, they'll actually have a locator map. You can click on your county and it'll put you in touch with your local prevention coordinator, and they can tell you the local coalition that's where you're living.
Yeah, I think back on the last year or so about some of the things that our community has done, and we've held some kind of open forum meetings with business leaders, health professionals, and just kind of open to anybody. And those have been some of the more valuable meetings, because the people who live in the communities, they have great ideas, right? Healthcare people or not healthcare people, they have great ideas about, have you looked at reaching out to this specific population this way? And so helping give ideas, I think, I mean, people are smart and they have good ideas and they see gaps that we don't see. In our little world, we have gaps that we don't see. And I think it takes a community to help with that. So just being involved, I think, comes down to.
All right. Let's see. We do, just as a side note, the next panel or the next session doesn't start until 3:30. So if we do need to go past 3, if there's questions, feel free to keep, submitting those, because we do have some extra time if it's needed. But the final question I currently have is, do you see any difference between youth and adult in seeking care or help with suicide or mental health in general? What are they currently doing?
Well, I can answer that. Just in my clinic, I don't see as many kids in my clinic. I think that a lot of the youth are getting resources through school and through health departments and some maybe church and other communities resources, I tend to see more adults, right? And so because they're coming to clinic for their high blood pressure and cholesterol medication or whatever. And so, I mean, I see plenty of young kids doing well child checks, but I don't see as many of the at-risk teenagers. You know, at that age, they're just not coming into clinic. They're not sick people. They don't need too many vaccinations, and they're kind of doing things on their own. So that being the point, you know, that brings up a gap, right? Like, how do we get to the youth a little bit better, and how do we get them to open up? And the schools are doing a ton. I mean, if I sit down for a half an hour with a superintendent and the district superintendent and hear his list of 50 things that they're doing, it's incredible work that they're doing. But I always think, how do I project myself into that, right? How do we get healthcare into that? Because it's a big burden, I think, for the school system, and having them do it alone, like was mentioned earlier, we can't do any of this alone. It takes a village, but I'd be curious to hear thoughts from others.
Well, one of the things that we do is we also have the youth mental health first aid classes, which teaches adults how to recognize the signs and symptoms in our youth. And we push that out through the teachers, coaches, Girl Scout leaders, those types of things. The kids also are really involved in social media and any of the technology that maybe someone my age isn't. So there is the Safe UT app that I would encourage that all teens should have that on their phone, and all parents should have that on their phone. Most of our schools throughout the state are connected to that. So if anybody's concerned, they can report a problem and somebody will address that.
I think that's so true what Robin said. The kids are more interested in using apps. The Strengthen Me app that's new. My3 is a great app for a safety plan. So I'm seeing that youth are actually more willing to talk about mental health issues because they have not grown up with that stigma surrounding it. I think our real challenge is trying to address mental health issues with middle-aged males because they are more resistant because of the stigma. They don't want to talk about their feelings. That's a topic that they're uncomfortable with. And so I think that maybe with some of our young kids, they're more comfortable talking about that, and they may be more willing as they see the need to reach out and get some help. But we do need to do a little bit more work with our middle-aged male population in order to address suicide in a way that's comfortable for them.
Yeah, and I'd like to echo what like Teresa said is in Utah, I mean, all of our 13 areas, we have, you know, health departments in all 13 areas and local mental health authorities that both work on suicide prevention objectives. And a lot of the focus really statewide, a lot of our focuses have been youth-based, right? Like we, you know, the schools are doing a tremendous amount of work. There's a lot of things going on. But when we do look at overall suicide deaths in Utah, about 6% of suicide deaths are youth. The majority of our deaths in Utah are middle-aged males. And so really that's a population that we're really working hard to find ways to reach those people. And when we look at like what Teresa and Robin are doing, is they're doing tremendous work that does exactly that, where we're reaching those populations, you know, where those working age males are. And so those are things that we're really looking at is focusing on suicide as a lifespan issue. A lot of the media and the things that have been out has really kind of made this a youth issue, but it's not just a youth issue, it's a lifespan issue. We really need to make sure that we're being comprehensive and addressing it with all of our age groups. All right, so it looks like, did we get another? Nope, I think that's all of our questions. Are there any other questions that any of our participants would like to add? Give it a couple minutes and see if we get some more questions.
I don't think we've addressed the one that says, can you offer a few specific tips on what to say or do if someone says, I'm going to kill myself and I know that person has a gun? So one of the things as a former mental health case manager, one is to take all threats like that seriously. Make sure that they don't have access to that firearm. Involve law enforcement if you need to. The goal at that point is to keep them safe. Not to offend, and don't worry about offending them, just make sure that you keep them safe. And that person probably should be seen by a mental health professional.
Yeah, I would agree with that. We run into this occasionally, and there's certain, there's certain levels of I'm going to kill myself. It sounds silly, right? But there are some people who, when they say they're going to kill themselves, that might be a daily thing that they've had for years, and others might not be. So you do have to judge that. But certainly I agree with everything that you said, Robin. I also I have had so much success just being empathetic, right? About just telling these patients that is a hard thing to live with, right? I mean, literally that's so hard to have feelings like that. And I can't imagine feeling like that. Let's talk a little bit about this and what we can do, what I can do as your friend and as physician or neighbor to keep you safe. What do we do? Because more than anything, we need to keep you safe. I need you around, right? And just empathizing with that, I think, is really, really important. And thanking the patient frequently, or the person, thank you for trusting me with that information. That's not easy, and then the conversation will, typically kind of goes from there.
All right, looks like we have another question. What does the conversation look like for someone that feels they need to take their gun from a mid-aged male, like a father or family friend?
So it usually goes okay. That group has been a little bit more difficult in my experience, and I'm not dealing with huge numbers, but it usually goes okay. There's usually, I always try to ask the patient, who a trusted individual is, who's a good friend, a wife, a good friend that they hang out with, and then I ask if we can involve that person in the conversation for their safety, right? And then we have the conversation as the three of us about what we're going to do with weapons, and it usually goes okay. I've had a lot of success with that. There has been a little bit of pushback. One of the underlying themes of lethal means and weapons and guns is that gun people, one thing that they hold very, very closely is safety, right? They hold that close to their hearts. Gun safety is so important, and pushing on that and using that, right, a little bit of gun safety, using that to your advantage in a case like this, I think it's not as hard as maybe the perception might be.
I agree, Amy, and I think that one of the things that can be really helpful, and Dr. Spencer alluded to this as well, but letting them be a part of this, the decisions of how that's going to be managed after the firearms are removed. So that gives them a little bit of their control back about how that's going to be handled, and have a conversation about what that looks like, what's going to happen next. So I think letting them be a part of that conversation and that decision can be really empowering.
All right, I think we're going to go ahead and wrap up now. I first want to thank all of you for being here with us today virtually. We appreciate the time that you've taken to be with us and being flexible to shifting to this virtual. I really, really want to give a lot of thanks to our three speakers today, our three panelists. This has been amazing information, and hopefully it's something that you can take back to your communities, and you'll have some good good action steps that you can take kind of to move forward. And of course, if you have questions, if you want to reach out to any of us, our contact information is there, so please take that, reach out to us, visit the Utah Suicide Prevention Coalition website, check out the Division of Substance Abuse and Mental Health website to find those prevention specialists in your local area. And then, like I said, if you need any additional resources or information, please feel free to reach out to us. Thanks so much.
Yeah, thank you, Amy. Thanks for moderating, and a public apology for being the very last person to get their slides sent to you, I'm sure, in the history of ever. So I apologize. Thank you, everybody, and it's been a pleasure.
Thank you.